The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
But to your point, I mean, there's a lot of patients that are like, hey, I want to do something about this. I want to make it sharper. I'm willing to do anything other than surgery. What do you tell that patient?
So there are, of course, fillers. There's ways to melt fat without surgery. We can actually tighten. Well, there's some technology that can tighten things up a little. Essentially, to get to the SMAS, the structure that really is the framework or lattice of the face, there are technologies which tighten the SMAS. They don't do it that well. As a dermatologist or non-plastic surgeon, or if you're deathly afraid of surgery, hey, they work. I wouldn't just expect miracles from it. If you actually get some of these things which are sort of cranked up in terms of power, sort of to get a maximum result, weirdly enough, you can actually burn or damage or create scar tissue of the SMAS. So you want to avoid that. If you are overweight, of course, lose weight. And if it is a spot area, there is a great injectable called Kybella. We just inject it. It melts the fat, and it does a very good job of it. Finally, with dermal fillers, we can actually sort of augment the chin, augment the jawline, make it a little more like a hill, make it more prominent so that you have a more defined jawline or sharp definition there. Anything else that you wanted to add in terms of the non-surgical stuff?
Yeah, I want to highlight the judicious use of fillers and Botox, like you said. So I love the Nefertiti lift. So injecting Botox, I'm just demonstrating along the lower portion of the face and upper neck. That allows that platysma muscle, which is, I'll demonstrate it. So it's that one, when you see those bands that stick out of the neck, it pulls the face down. And so if you relax it, it kind of falls back, cinches the neck, and kind of paradoxically creates more definition there. That's a great, way to dip your toe in. And I like performing it in conjunction with some jawline filler. And the patients go, well, I don't want a bigger jawline. And I'm like, great. We're just looking to form an optical illusion here. So if we paste some along the border, it's almost like creating that like a knife's edge along the bone itself, and a little bit in the chin goes a long way to create more of that V-like shape. So, and we're talking, a milliliter, maybe 2 milliliters of fillers is not a lot of volume, but well placed. It can serve to straighten the jawline, and then that looks very elongating and creates more of an elegant transition from the face to the neck.
Yes. And then, of course, with Botox, we can actually inject it in the master muscles. So in case you have a very wide face, what I would consider a squarish face, if you get Botox to the master muscles here, the muscle you feel when you clench your teeth, we can actually make your face a little more V-shaped, which can be aesthetically pleasing, as well as make this angle, the side of the mandible here, look more defined overall. And that is very non-surgical.
Very non-surgical, very popular treatment too, because you get that tension relief in the back from grinding, and then also get that slimming. And some patients have very, very powerful master muscles, and I just Botox mine, so it's not working to demonstrate this. But when I haven't Botox mine and I bite, my fingers go like flying off my face. Like you literally can see them kick out like this when I bite. And right now you can just see just a little bit, but it's really, really, really marked when I haven't recently Botoxed them. And so I like that slimming effect that it gives. So just like we were talking about before with the facial analysis. So that's one of the ways that we're able to slim the soft tissues above to better highlight that jawline below. And it works really well.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.